Hi, good afternoon, everyone. Thank you for joining us for the Medical Board of California Midwifery Advisory Council meeting. While this meeting is being conducted with participating panelists and staff, this meeting is being streamed interactively using WebEx to allow for remote public comment in the same manner as recent meetings. Public comments for those who wish to speak will be heard for each agenda item. For individuals who may be attending in person in our in-person meeting location and remotely. In order to be ready to make public comment, we ask you please ensure your comments can be heard clearly by being connected to the audio of this meeting through the proper method. If you're having difficulty hearing the audio of this meeting, it could be because the device you're connecting with has bandwidth limitations. If you do have difficulty hearing the audio of this meeting using your device, please click the ellipsis button at the bottom of the WebEx application or the audio and video menu item at the top of the WebEx application, and then select Switch Audio. You'll see an option to call in and will be provided with a telephone number, access code, and attendee ID that can be used to connect to the meeting audio via phone. Using the information provided, it will automatically disconnect your device's audio and connect the phone to the name you joined the meeting with. By using this method, if you're having audio problems with your device, this will allow you to still participate and hear the audio of the meeting. Please see the View Additional Meeting Information link on the first page of the meeting agenda for more information on connecting to the meeting and accessing meeting materials. Thank you, Ms. Weisner. You can now start the meeting.
Good afternoon, everybody. It's 1:07, and I'd like to welcome you to the Midwifery Advisory Council meeting. I'm Madeline Weisner, and I'm the chair of this advisory council. Since this meeting is being conducted via WebEx, I will ask all MAC members and speakers to announce themselves by name before speaking for clarity of the official record. All MAC members are able to unmute themselves to speak during the meeting. Please place yourself back on mute when not speaking to reduce background noise for all participants. Following such online meeting etiquette will ensure the best audio quality for everyone. During each call for comments from MAC members and speakers, we will ensure that all comments that can be accommodated are heard before proceeding with the agenda. During each agenda item, the host moderating this WebEx event will activate the Q&A and hand-raising features of WebEx, and will ask anyone wishing to make a public comment to indicate so by replying yes in the Q&A window or by using the hand-raising features. The host will then call on individuals who indicated they wish to make a public comment by name, and when called upon, the host will unmute you and you'll be able to make your public comment then. After the comment, you'll be placed back on mute. Please see the agenda for WebEx instructions on how to connect from the link on the agenda and additional instructions. And it did seem a little hairy this morning getting in. I think the email link worked, but the other link didn't. So I see you, Ms. Wilson-Tenev. I know what happened. MAC members, as a reminder, during today's meeting, any items requiring a vote will be done by roll call vote. This means that once a motion is made and seconded, Ms. Moriarty will call each of the names individually to request our vote. I would now like to call the meeting to order and ask that Ms. Moriarty please call the roll.
Thank you, Ms. Weisner. Faith Freeman.
Here.
Thank you. Dr. Kenneth James. Tamara Robertson. Karen Rosley. I'm sorry, Ms. Rosley, can you unmute?
There we go. Yeah.
Thank you. Thank you. Mason Wilson-Tenev.
Here.
Thank you. And Madeline Weisner.
Present.
Thank you. We have a quorum.
Awesome. Perfect. Thank you. Moving on to agenda item 2, public comments on items not on the agenda. Are there any public comments?
If anyone would like to make a public comment, you can do so by just raising your hand here down at the bottom of the WebEx screen. I'll open up the Q&A window here just a sec to see if anyone would like to make a public comment that way as well. Got the Q&A windows there. If anyone's having trouble with the hand raising feature, I'll give you a few seconds to see. You don't need to type your question, just say you'd like to make a public comment. Okay, I'm not seeing any hands or any requests at this time.
All right, thank you. Moving on to, oh, sorry, a train is going by me right now. 1 second. I don't know if it's very loud for you guys. It's really loud on my end. Let's see, moving to agenda item number 3, approval of the minutes from the September 11th, 2025 MAC meeting. Are there any additions or corrections to the September MAC meetings minutes from the members? Okay. May I have a motion to approve the minutes from the September MAC meeting?
Motion to approve.
Thank you. Anyone second? Ms. Rosalie seconds. Are there any public comments?
If anyone would like to make a public comment on agenda item 3, please do so by raising your hand or just typing you'd like to make a public comment into that Q&A box. Give you a few seconds here. Not seeing any requests at this time.
Ms. Moriarty, could you please perform the roll call vote?
Yes, Faith Freeman. I'm sorry, you're muted. Faith Freeman. You're muted right now. There you
Okay.
go.
I wasn't saying anything. I'm sorry.
Oh, are you yay or nay for the meeting minutes?
Oh, yay. Sorry.
That's okay. Thank you. Karen Rosalie.
Yay.
Thank you. Mason Wilson Tanev.
Yay.
Thank you. And Madeline Weisner.
Yes, aye. Thank you.
Thank you.
All right, the September 2025 MAC minutes are approved. Moving to agenda item number 4, which is the report from the MAC chair, which is me. Before I forget, I wanted to make an announcement surrounding opportunities for licensed midwives to be involved in the investigations process at the medical board. The medical board's enforcement program has consultant and expert reviewer opportunities for licensed midwives. Consultants evaluate the specific standard of care issues raised by a complainant to determine if further investigation is required. These consultants review complaints to determine whether a formal investigation is needed. Participating physicians and licensed midwives are reimbursed at $75 per hour for record review and report preparation. Training is online and self-paced. Expert reviewers provide expert reviews and opinions on board cases and testify at administrative hearings. Licensed midwife expert reviewers must have an active midwifery practice for the past 2 years, have no current complaints, no prior discipline, and must be willing and available to testify in court. For application and eligibility requirements, go to the board's website at www.mbc.ca.gov, click on the enforcement link, and then the links to medical consultant and expert reviewer programs. Moving on to my report, I want to thank all 12 of you tuning in today, as well as my fellow MAC members for your continued engagement at these meetings. I recently had a series of meetings with board staff and leadership surrounding the budget for the licensed midwife program, as well as the upcoming sunset review. I really appreciated being included on these and having all of my questions answered. They spent so much time with me going through every line item of this dang budget, including the executive director of the medical board met with me, just surrounding the future of licensed midwives in California. So I do want anyone viewing the presentation later today to know that they did meet with me ahead of time to discuss the budget. I did give them my opinions. I also took the time to watch the last medical board meeting where it was presented to the full board. It did not look like the medical board had a whole lot of questions about that proposed budget. And in these meetings with staff and with medical board leadership, they gave me an amount of information about the midwifery program spending that was technically publicly available, but it had not necessarily been broadcast at the MAC. So it was interesting, and you'll see this has its own agenda item here. I was disappointed that the MAC meeting immediately following my discussions with the medical board was canceled due to a lack of quorum, which looking at all other advisory councils meetings in California and even federal ones, it seems like a lack of quorum is an issue with all of them. We're not special for that. But I'm looking forward to hearing more from the medical board today, as well as hopefully some public comments surrounding the fund. This will be on agenda item number 10, I think. So stay tuned. Stay on. To anyone who hasn't heard it before, the MAC is not involved in promulgating regulations for licensed midwives, nor are we involved in any part with the investigation process into midwifery practice. The MAC also has no say in discipline or remediation or probation or any part of enforcement for licensed midwives. We are, as MAC members, in the dark on most of those things. So it's really understandable to me that midwives would not be interested in participating on the MAC, given that already, there are a lot of competing priorities in midwifery practice. And perhaps like the people with the most experience attending MAC meetings are the least compelled to join the MAC. That's really understandable. Also, I know I say this all the time, but the MAC is really the only official line of communication between licensed midwife workforce and our regulatory body. It's the accepted place where you can air your grievances publicly from the licensed midwife community, from clients to our regulator, and it can go on public record. These meetings are live streamed. They're on YouTube, I think, forever. So if the MAC is going to be successful in any way, it's going to depend on having members that reflect the stakeholders in midwifery care in California, as well as ideally some sort of, maybe in the future, a legislative transformation that allows the MAC to not be an advisory council and allows it to be something else, a different type of entity. It sounds like another option of the MAC being a committee and not a council has been pursued. And that would give the MAC some power in terms of regulation or investigation or discipline. But at this point on that topic, I'm intrigued and encouraged by any attempt at changing how the MAC functions. I am, however, pretty disappointed at how remarkably tame MAC meetings have been for the last several years, despite what I see as objectively poor material conditions for midwives and for families in California. In terms of midwifery news, I wanted to share that California Healthcare Foundation released its 2026 Maternity Care in California Almanac just a couple weeks ago, the end of March. The document itself is free on their website, California Healthcare Foundation. I wanted to share some of the greatest hits with you, though. The total number of births in California has declined. I think everyone knows that. About 1 in 3 people giving birth in California were born outside the US. About 40% of births are covered by Medi-Cal, which is a number that has declined. About 3/4 of those births covered by Medi-Cal are covered via a managed care plan, and there are 24 of those plans in California. And at this point, countless independent physician associations or medical groups that have care further delegated to them. So many midwives working in California are interacting with over a dozen health plans just to serve their normal patient mix. Just over half of births are covered by private insurance in California, which has increased pretty dramatically. And about 1 in 3 of those folks are Kaiser patients. So Kaiser makes up a pretty large proportion of people birthing in California. 56 hospital birthing units have closed since 2012, with over 1 million Californians experiencing an increase in distance to the closest birthing facility. 40% of California's birth centers have closed just since 2020. And obviously, with all of this, racial and ethnic disparities persist across a variety of maternal quality measures in California. So licensed midwives are uniquely poised to be a solution or part of the solution to all of this drama, all of these concerns. But I just want to kind of set the temperature a little bit of the conditions people are birthing in 2026, as these conditions obviously are going to inform who's seeking out midwifery care, who's able to receive it. Let's see, since the last MAC meeting, I've been contacted a number of times from licensees regarding midwifery issues they wanted me to share at the MAC. Obviously, there's like a war. There's a war and a fuel crisis that's impacting midwives every day. Many midwives can't afford to visit families at home as frequently as they would like to. They have shifted back to more frequent telehealth or office visits. Many midwives have left practice altogether or are working, they're maintaining their licenses, but they're not practicing community midwifery, or they're working in alternate settings such as FQHCs. I do think that group practices with shared call are becoming more common for new graduate midwives, which is really encouraging to see that people are coming straight out of midwifery school knowing that they shouldn't be working 365 days a year, 24 hours a day, 7 days a week. So that is very, very encouraging. It doesn't seem like there's a robust enough workforce to really make that work either. I got a couple messages about the ongoing pandemic and the new COVID variant, which would appear to be affecting children and babies more. People are seeing it in midwifery practice more. And I haven't really seen any guidance from the medical board on that, or from the CDC for that matter. The public health resources these days are lacking, to say the least. Many midwives have brought up caring for pregnant people with long COVID as well, from repeated COVID infections, or having challenges with work related to having long COVID themselves. I expect this will continue to be an occupational health concern for midwives and really anyone else providing healthcare services. Lots of messages about private insurance companies just robbing everyone. I'd say that's the majority of the messages that I receive as from people who know that I'm the chair of the MAC and they think I might be able to do something about it. I probably can't. Many midwives are also struggling to find or keep reliable insurance billing providers in California. And then one person reached out to me specifically to tell me space isn't real. So there's a good healthy mix of attitudes surrounding reality and California midwifery. There are several promising midwifery education programs coming up, including 2 licensed midwife programs that I've discussed at previous meetings. I did want to mention there's also a new nurse midwifery program in Sacramento coming at University of the Pacific. Looks pretty cool. There are multiple organizations working on really clarifying and uplifting the legislative requirements for midwifery practice and safe, well-integrated midwifery care. I think Mr. Bone is going to be updating us on relevant legislation today, hopefully. Let's see. On a personal note, my term expires on the 30th of June. I didn't reapply. I live overseas. I think everyone knows that now. I think chairing the MAC would be more well suited for someone who lives and practices in California. I think we could all agree on that. We have really capable candidates who are continuing their terms. I've been waiting with bated breath to see who applies for the MAC. The last that I heard, no one had, but maybe that's changed in the last 72 hours. As I've communicated to board staff, I will, of course, see my term through, and I'll continue to show up as long as I'm needed, basically. One thing I do want to nail down today is to get us some presentations on the books with the medical board surrounding LM practice, as that might be the only way midwifery stakeholders have a real voice directly to the board is at their meetings. I also just want to extend an invitation to anyone who's thinking about applying for the MAC that I will help you, and I will explain to you what's going on as best I can. I promise. So if you're thinking about it, do it. It's not a complete waste of your time, I hope. So that concludes my report from the chair. Are there any questions or comments from the members? Cool. Shall we go to public comments?
Yes, if anyone would like to make a public comment on this agenda item, please do so by raising your hand or just typing anything in that Q&A window. Give me a few seconds to see if anybody queues up. Okay, I'm not seeing any requests at this time.
All right, sounds good. We can move on to agenda item number 5. This is the report from the Task Force on Medi-Cal related issues. Just yesterday, Midwifery Access California, which is known as MACA, and the Department of Healthcare Services conducted a listening session surrounding the midwifery benefit implementation among managed care plans. I was unfortunately unable to make it to this meeting, but reviewed the notes from the meeting yesterday. Overall, it seemed midwives continue to share the same complaints surrounding the licensed midwife benefit that have been ongoing for years, including managed care Medi-Cal plans failing to comply with what is known as network adequacy, where the plans are required to contract with at least one licensed midwife in their entire health plan, and they fail to do that a lot of the time. Other complaints involved burdensome administration requirements associated with taking Medi-Cal, inadequate or incomplete reimbursement, a lack of timely payment, as well as inaccessible professional liability insurance. Midwives were again asked to provide proof that this is all occurring, which is something I personally have been providing to the department and the health plans for nearly a decade now. It does sound like there's a concerted effort among the personnel that have been communicated with at Department of Healthcare Services to really fix this and broaden this benefit. And there has been incremental progress over the course of the last few years. They are continuing to work with us to ensure all codes within the licensed midwife scope are reimbursable. The current codes list, if anyone would like to see it, it's publicly available. It's located in the non-physician provider manual on the DHCS website. So if you're curious, I know when I first got licensed and started taking Medi-Cal, we had 16 codes we could bill. Now it's like over 100. I did also take the time last night to manually go through Medi-Cal's data set of currently enrolled licensed midwife providers, which is also publicly available. You can do a search for a profile of enrolled fee-for-service providers and then narrow it down to licensed midwives. A sizable portion of the midwives listed are not licensed midwives at all. And are therefore miscategorized. Some of the folks on the list are nurse midwives, some of the folks on the list are completely different professions, but for some reason listed as licensed midwives. Recently, it also came to light that many of the licensed midwives on that list are ordering or referring providers only, which means they're included in the data set, working with families who have Medi-Cal, but they're not billing Medi-Cal for professional midwifery services. What I'm getting at, I guess, is that licensed midwives are perhaps overcounted in the Medi-Cal system, and there are far fewer licensed midwives actually taking Medi-Cal than even Department of Healthcare Services knows or can confirm. Another point that needs to be made about this is that many midwives, most, I would say probably all midwives in California, do provide care to Medi-Cal beneficiaries. Many bill the managed care plans on single case agreements, but most are not approved Medi-Cal providers. So what I've been really trying to do is to get the Department of Healthcare Services to have a very distinct, clarified pathway for those midwives who are doing those single case agreements, without having to be tied to being enrolled Medi-Cal providers and bill everyone's Medi-Cal. Many of the reforms that we've made at Medi-Cal are for midwives who are enrolled as fee-for-service providers, but that isn't actually who's taking Medi-Cal anymore for the most part. So MACA as an organization continues to be the most well-prepared and consistent communication between midwives and the Department of Healthcare Services. So if anyone is interested in that, you can look at the MACA website, midwiferyaccessca.org, I think. This concludes my report, but of course I'm happy to answer any questions I can for members. Or we can just carry on to public comment. Are there any public comments?
If anyone would like to make a public comment here on agenda item 5, please do so by raising your hand or typing in that Q&A window. Give you a few seconds here. Not seeing any requests at this time, Ms. Weiser.
Okay, cool. Let's see, moving on to agenda item number 6. I will be providing the update on midwifery related legislation. That's me. That's not Mr. Bone. He couldn't be here. So let me just pull up that attachment here. Okay, I can do this. All right. So this report is intended to provide the MAC with an update on legislative activity related to licensed midwifery since the prior MAC meeting, and no action on this item is required. The following bills were signed into law in 2025 that may be of interest to the MAC. AB 55 revises the licensing requirements for an alternative birth center with respect to the types of perinatal services that must be provided at that facility. Further, the bill requires the center to have a written hospital transfer policy. At the time of transfer, the bill requires the certified nurse midwife or licensed midwife responsible for the care of the patient or a client to provide the hospital with all the individual's medical records that are available at that time, and to speak with the receiving provider about labor up to the point of transfer and any other information not yet added to the medical record. When providing an initial orientation to new patients or clients at the center, AB 55 requires them to be informed of the estimated time it would take to transfer them to a hospital, provide that related information, and include a signed acknowledgement of receiving this information in the patient's or client's medical records. AB 55 also updates a code section that authorizes Medi-Cal reimbursement to alternative birth centers by deleting the requirement that the center be certified as a CPSP provider. The bill also states that the center must meet the standards for certification established by the American Association of Birth Centers. AB 836 requires the California Department of Healthcare Access and Information, which is HCAI, to conduct a statewide study on midwifery education after receiving future spending authority by the legislature. The findings of this study are intended to support the creation of a sustainable strategy that will help develop the midwifery workforce in California that reflects California's racial, ethnic, linguistic, socioeconomic, and geographic diversity. SB 470 extends the authority of state advisory bodies like the MAC to continue to meet remotely until January of 2030. And there is a board staff analysis for additional information on that one. SB 669 requires the California Department of Public Health to develop a 10-year pilot project to establish standby perinatal services in up to 5 critical access hospitals in rural areas with limited access to comprehensive perinatal services. The pilot program prioritizes hospitals in the counties of Humboldt and Plumas. The CDPH would be required to consult with a wide range of stakeholders, including LMs, to develop this project. In terms of pending legislation, we've got a few. AB 408 is a board-sponsored legislation that authorizes the board to establish a health and wellness program that will offer treatment and monitoring to the board's licensees and applicants related to substance abuse disorders or other health conditions that may impair their ability to practice safely. This bill is pending in the Senate Judiciary and will be further considered by the legislature later this year. There is also a board staff analysis for further information on that one in the agenda materials. SB 626 would, among other provisions, require healthcare practitioners, including licensed midwives who provide perinatal care for a patient, to screen them for a perinatal mental health condition according to applicable clinical guidelines and the standard of care appropriate to their scope of practice. Providers who diagnose and treat the individual must do so in accordance with the appropriate standard of care and may refer their patient or client to another practitioner authorized to provide this care. This bill is pending on the Assembly floor. There's a staff analysis for that one too. SB 1271 would require the board to update the LM survey offered at the time of initial licensure and license renewal to request that LMs voluntarily provide the following information. The LM's eligibility to serve as a clinical preceptor for student midwives enrolled in a midwifery education program approved by the board, including whether they have met the minimum requirements to become a clinical preceptor. If they answer yes, they will be asked the following: if they are currently available or anticipate becoming available within the next 2 years to serve as a clinical preceptor for student midwives. If they answer that they are currently available, they will be asked for the maximum number of student midwives they are able to supervise currently, what California counties they currently practice in, and what California counties they are available for clinical preceptorship. The primary practice setting or settings in which the LM would offer to serve as a clinical preceptor. If they answer no, they will be asked to provide the primary reasons for their unavailability. The bill states that an LM shall not be required to provide the requested information and shall not be subject to discipline for not providing this information. The board would be required to maintain the confidentiality of the information collected and only release it to the public in an aggregate form that cannot identify an individual. The board, however, would be required to provide the HCI on a quarterly basis with the individual LM data collected for the purpose of statewide midwifery workforce planning, analysis, and public reporting. HCI shall maintain the confidentiality of the data collected and only release it in aggregate form that cannot be used to identify an individual LM. The bill also requires HCI to provide a report to the legislature on their findings by January 1, 2028. Board sunset review in 2027. The board will undergo sunset review in 2027 and therefore be submitting a sunset report as required by the legislature in late 2026 or early 2027. A sunset report provides a review of the history of the board, including a detailed examination of its activities following the prior sunset review in 2023. So that concludes the update on midwifery-related legislation. Are there any questions or comments from the members? I have a comment. I did want to include AB 2160, which would allow IBCLCs to enroll as Medi-Cal providers. I bring this up because a lot of midwives, self-included, have become dual credentialed as LM IBCLCs, and this may provide an option to bill for services that we know are already being rendered to families with Medi-Cal. And that one is still working its way through. It's been referred to appropriations. Are there any other comments from the members? All right, are there any public comments?
Yes, if anyone would like to make a public comment here on agenda item number 6, please do so by raising your hand or typing anything in that Q&A window which you called upon. Not seeing any requests at this time.
All right, moving to agenda item number 8, discussion and possible action on presentation to the board regarding midwifery updates. So as we have just,
I'm sorry,
yes.
Ms. Weisner, we're actually on number 7.
Dope. Excuse me. Sorry. All right. Take it away, Ms. Moriarty.
Thank
Proceed
you.
with the program update. Sorry.
Thank you. Please turn to page 7A1 for the midwifery program licensing statistics. In the first quarter of fiscal year 2025-2026, the board received 2 new applications, issued 4 new licenses, and renewed 58 licenses. In the second quarter, the board received 8 new applications, issued 7 new licenses, and renewed 53 licenses. In the third quarter, the board received 4 new applications, issued 5 new licenses, and renewed 64 licenses. Please turn to page 7B1. In the first quarter of fiscal year 2025-2026, the board received 42 transfer of planned out-of-hospital delivery to hospital reporting forms for licensed midwives. The board received 38 in the second quarter and 42 in the third quarter. Please turn to page 7C1 for enforcement statistics for licensed midwives. In the first quarter of fiscal year 2025-2026, the board received 5 complaints and referred 0 for investigation. In the second quarter, the board received 6 complaints and referred 0 for investigation. In the third quarter, the board received 10 complaints and referred 1 for investigation. Please turn to page 7C2. In the first quarter of fiscal year 2025-2026, the board received 2 complaints for unlicensed midwives and none were referred for investigation. In the second quarter, the board received 3 complaints for unlicensed midwives and none were referred for investigation. And in the third quarter, the board received 2 complaints for unlicensed midwives and none were referred for investigation. Please turn to page 7C3 for enforcement statistics for transfer of planned out-of-hospital delivery to hospital reporting forms for licensed midwives. In the first quarter of fiscal year 2025-2026, 42 transfer of planned out-of-hospital delivery to hospital reporting forms were received and 45 were closed by the board. None were referred for investigation. In the second quarter, 38 transfer of planned out-of-hospital delivery to hospital reporting forms were received and 33 were closed by the board. None were referred for investigation. In the third quarter, 42 transfer of planned out-of-hospital delivery to hospital reporting forms were received and 42 were closed by the board. None were referred for investigation. Please turn to page 7C4. In the first quarter of fiscal year 2025-2026, the board received 4 transfer of planned out-of-hospital delivery to hospital reporting forms for unlicensed midwives, and none were referred for investigation. In the second quarter, the board received 1 transfer of planned out-of-hospital delivery to hospital reporting forms for unlicensed midwives, and none were referred for investigation. And in the third quarter, the board received 3 transfer of planned out-of-hospital delivery to hospital reporting forms for unlicensed midwives, and none were referred for investigation. Thank you. That concludes my update. Are there any questions?
I have a question. Thank you. Thanks for doing that. It seems like overwhelmingly complaints and complaint forms surrounding unlicensed midwives are not referred for investigation. Does that seem accurate?
That seems what the stats would show.
Yeah. I'm wondering, like, so it's HQIU that is doing the investigations?
Correct.
Or is HQIU deciding whether to do the investigations? Or
Carrie,
both?
do you want to?
I guess what I'm wondering is, like, if there's a complaint surrounding the unlicensed practice of midwifery, are these just doulas that are being, not just, are these doula attended births where someone in the hospital is filing a complaint saying the doula is acting out of scope and trying to be a midwife? Or are these complaints truly like complaints about someone who is acting like a midwife, or neither? Or can,
Right.
is anyone allowed to share?
We can't
Yeah.
tell the nature of the complaints based on the statistics. These
Yeah.
are how the complaints are coded. And so whether it could be a complaint that this person is advertising as a midwife and performing services as a midwife, the complaint may say that, but then when it's triaged, it's not it's not supported by what the evidence shows. And so it doesn't go any further than that. They could be anonymous complaints where we can't get additional information that supports that this person is practicing midwifery in an unlicensed status. It could be that they've mischaracterized that the person is unlicensed and they actually are licensed. And so, you know, they describe what the complaint is and it's coded, and then when it goes further, it doesn't meet the requirements for further investigation.
Got it. Okay, interesting. Thank you. I appreciate that response, and I know that there's a lot that can't be shared. I know that there's a lot that can't be shared. I was just a little intrigued by the discrepancy between complaints and investigations. I'm not complaining at all. I'm just noticing. Are there any other questions or comments from the members about agenda item number 7, the program
For you,
update?
Ms. Weisner, yes. I noticed that the out-of-hospital report, for you. I noticed that the out-of-hospital reports are not in alignment with the number of transfers that are happening, which is telling me that not all transfers are being reported. Is there a mechanism, or what would be the mechanism for reviewing that particular requirement and maybe eliminating it? Is it helping midwives? Is it helping the consumers? Is it helping the practitioners in the hospital? And if not, it's just burdensome, or it's not representative. So 42 transfers is not as many transfers as there were in California. What can be done to review that and see if it's actually serving the public?
What I see, my personal opinion, is that having worked in a hospital is that it's another form and I don't want to do it. It's another form that's easily forgettable and not particularly relevant, right? And not relevant to patient care at that time. And the people tasked with completing the form are often also tasked with direct patient care, and they would rather take care of their patient than they would fill out the form, right? I think that I don't think that there is a lot of congruency between the transfer forms and the number of transfers, the character of the transfer, the reason of the transfer. I do think that what I've heard from other licensed midwives is that people fill out the forms when they're upset or when they're like have an adrenaline rush from an emergent transfer, and so maybe the information isn't 100% not clouded by however the person filling out the form is feeling about that transfer. But as far as the specific content of the transfer, the only way that the midwife knows the content of that form is if they fill it out together with the receiving provider, and then they take a picture and put it in their client's medical record, which is what I recommend midwives do, or to pre-fill out the relevant information and give it to the receptionist at labor and delivery and be like, hey, I did this for you because I know how hard you work and I don't want you to have to do another form. So I did the stuff that you don't have to dig up the information for this person. Whether or not that's the way it's supposed to be done, I'm not sure, but I don't think most of the system with these forms is being done the way it's supposed to be done anyway. But maybe Ms. Webb has some better advice. Better
And I'd love
advice
to
than I
hear
do.
that. I'd love to hear that. So what I'm hearing is that these forms are used as a proto-complaint process by those people who are upset in the hospital, reflective of all the transfers, and that the licensed midwife has no insight into what's being said about their practice, and so therefore cannot address what's being said about their practice. So if all these things are true, and this is really a proto-enforcement measure, how can we review whether the public is actually being served by this? And if they're not, how do we eliminate this particular requirement?
I think the requirement is in the legislation. So it's one of those things where it would require legislation to get out of it. And I do want to say that when I have communicated with board staff about these forms, they've been the topic of conversation for years. Everyone has expressed their discontent with them. Everyone together is trying to make these forms either as useful as possible or and certainly there are hospitals that do the form for every single person because they're like, that's part of our process. They've baked it into their transfer policy and they're like, yeah, we're required by law to fill out this form and therefore we will fill it out every single time someone comes in. But I do think that we can all agree that it's not a perfect document. And I think that that's reflected in the number of forms that they get that are not referred for investigation, because anyone looking at them would be like, oh, this person was having perhaps a more petty day filling out this form. Or sometimes they look at it and they're like, this is very useful information being provided on this form. And maybe they look into it further. But how reliable it is, I think we can all agree it's not a perfect system. But I guess I'm wondering, like, what would be a better system? You know? Like, what would be a better way of tracking this? Does it need to be tracked? Would it make more sense for it to be tracked not by investigation at all, you know?
I think that that's a subject that's really interesting and would certainly require some investigation. But the fact that midwives alone are required to have a report sent to their disciplinary body in the case of a transfer, and not any other providers who are related to that particular care, seems to reinforce an oppressed quality of midwifery care that I'm not interested in continuing if it's not actually serving the public. So that was my question. But if the answer is it's a legislative fix, then that's going to be a more difficult thing to do.
Yeah, it's policing. It's policing for sure. And the approach that a midwife or a hospital-based provider might have to policing is probably the approach that they have to this form, to either comply and fill it out, or to throw it in the garbage, or to have the least amount of interaction possible with this form. I think it's a really good proxy for a relationship to policing in general, because that is how it feels, whether it's actually being used in that way or not. That I think that's probably why it was put in the legislation, right? Like I don't think it was put in the legislation because someone was curious. I think it was put in the legislation because that was a way to control midwives.
Okay, one last question, and then we can move on from this. I'll have just one more quick question. If
these are all my opinions, by the way, personal opinions.
Right. If a midwife were to fill out a report, a transfer report, and send it to the medical board, would it be read, and would that go into any kind of record?
I think that's a question for Ms. Webb. I know that we've talked about this with like the pathway for the forms, but I think it would be, they're received by the complaints unit, and then they're immediately triaged to, oh, we need to look at this, or like that can be recycled. That goes in the recycling pile, you know, or the shredder. But maybe Ms. Webb has more information about that.
So documents that are received, so if a midwife submitted the form, I mean, that wouldn't be in compliance with the law, but would it be, you know, reviewed? Yes. As far as the legislative change, as Ms. Weisner indicated, we're coming up on a sunset review, and well, and even before then, at any time, the midwives can request that change, but sunset is a particularly good time to seek significant changes of this sort.
Thank you, Ms. Webb.
And would that be via CALM, or could any midwife contact the medical board and say, I'd like for you to consider transforming this language in the sunset review?
Any midwife, any person can contact the medical board with legislative ideas, and as well as your representatives, and CALM certainly has the contacts to do that as well.
Okay. Cool, thank you. Do you feel like that answered your question, Ms. Wilson? Okay, cool. Are there any other questions or comments from the members? Are there any public comments?
If anyone would like to make a public comment on agenda item 7, please do so here by raising your hand or typing anything in that Q&A window. Give you a few seconds to queue up. First up here we have Carla Michael. Carla, you should be receiving a prompt on your end to unmute.
Hello. So my question is in reference to what was just discussed. If a midwife or a public member, anyone would like to submit information about something they would like to do for the sunset, how would they go about doing that?
Just a reminder, this is just a public comment period rather than a back and forth. And so if you have any other public comments to make, go ahead and do that. But just broadly, I'll say that you can go to the medical board's website, mbc.ca.gov, and there's a contact form there, and you can put in whatever question you have or suggestions.
Carla, I've sent you a prompt again if you had anything to add on, but if you don't unmute, I'll just take that as that was all of your comment. Okay, looks like that was it. I don't see any additional requests this time.
Awesome, thank you. All right, moving to agenda item number 8. This is a discussion and possible action on presentation to the board regarding midwifery updates. So we have previously discussed like having the MAC do a presentation for the medical board, as the MAC has in the past, on midwifery related topics. So my idea, synthesizing the discussions that we previously had, would be for us to try to get a standing agenda item with the medical board for every meeting, because the MAC chair already gives like the MAC report sometimes, particularly if we need to like approve members or minutes or whatever. So I would propose that we ask, because if we don't ask, we won't get it at all, that we have an agenda item every quarterly board meeting so that the MAC can have a regular time slot at those meetings, or agenda item at those meetings. Some ideas that we have talked about before have been a presentation on licensed midwife care that is timed for when new medical board members start their terms, so that when people are new at the board, they get the information as soon as they start, right? So that could maybe be like one a year, one presentation a year that's like, what's a licensed midwife? Basic scope stuff, basic, like the scope of work that we do, right? and the scope of the medical board in regulating licensed midwives and how that history came about. And then another presentation could be specific scope issues. It's been suggested that we talk about VBAC with the medical board because every time we interact with board members about VBAC, it tends to be midwives defending ourselves. And so maybe having some sort of positive and proactive dialogue surrounding VBAC with the medical board members would be good. Another topic idea was navigating the post-dates pregnancy. So what is actually done for families when they reach that 42-week mark where we're, where the legislature says that midwives are not to be caring for those folks anymore. I would say that that's like the number one challenge that licensed midwives express related to their scope. Honestly, it comes up the most frequently. Perhaps a presentation on consultation and collaborative care with physicians, possibly looping in, midwife centering organizations that do really, really good work with collaboration, like CMQCC and their community birth partnership. As well as my other idea was to have a presentation from consumers on midwifery care for the medical board. So looking at the motivators that consumers have for seeking out licensed midwife care and home or birth center birth from a consumer protection standpoint. My other thought was that at the most recent medical board meeting, there's been a lot of conversation surrounding maternal mortality, thankfully, because it's obviously still a really, really extreme issue in California is the rate of mothers dying surrounding childbirth, right? People giving birth, dying in pregnancy and in their postpartum. So at the most recent medical board meeting, it had been suggested that board members will be looking into data and looking into how the medical board can partner with organizations surrounding maternal mortality. But what there was no mention of, because there were no midwives there, was the incorporation of midwifery care on that task force. I don't think they used the phrase task force, but consumer groups that saw it are now widely using the phrase task force. So that was my other idea, would be to, in the context of having regular midwife, licensed midwife licensee presentations at medical board meetings, at the quarterly board meetings, to invite them to partner with the MAC or with their midwife licensees surrounding maternal mortality. So those are the ideas that I've thrown together about this. The question that I have for Ms. Moriarty is, can we have a standing agenda item at the quarterly board meetings? Yes.
Well, we currently do have a MAC standing agenda item. Carrie, can they incorporate this into that agenda item?
The presentations, it's time permitting and as approved by the board president and the executive director. And so I'm not in a position to say yes or no, I guess is what I'm saying. And even if you made a motion that this is what you want, ultimately the president and the executive director makes the decision based on other items that are on the table for discussion. And so certainly maternal mortality and LM's role in providing care to our citizenry, it's very timely, and you know, as you recognize, we've had LM presentations before. Anyone can ask for a future agenda item during the meetings. That's always the last agenda item, not always, typically the last agenda item before adjournment. And you can also write in requests for agenda items. So there's lots of options to request agenda items. And you know, as staff, we have certainly heard that you're interested in presenting to the board, and we'll be elevating it up to make this happen.
Okay, thank you. So I know that the next time I would assume it will be me, give a MAC report to the medical board. Usually we list what we talked about at the meetings. And so one of the things that I'll talk about is that we want to be doing these regular meetings, and that we'll continue to, or these regular presentations, and that we're going to continue to demand this or ask, request, invite ourselves, whatever. And that will be the way that we convey that, correct? One of them. And
One
then
of the
members
ways.
of the public, yeah, so members of the public could call in, or anyone could call in during the agenda item that is future agenda items and say, hey, I really want to hear from the midwives about post-AIDS pregnancy. Okay, so we could do that as well.
Yes.
Okay, so for the purpose of this, do you think it would carry any more weight at all whatsoever for us to have a motion to ask the medical board for a slot at the upcoming meeting?
I do not.
Okay, then we're not going to do it. Cool, thank you. I know that previously I've had to like send slides ahead. Shall I prepare a presentation, send it over, and say I'm ready when you are to board staff?
You're welcome to do that.
Okay, cool, great. I will. Thank you. Awesome. Are there any comments from the members on this idea? Discussion, agenda item? All right. Shall we open it for public comment?
Yes, if anyone would like to make a public comment here on agenda item 8, please do so by raising your hand or just typing anything in that Q&A window. We can get you called upon. Give you a few seconds to see if anyone queues up. I'm not seeing any additional requests at this time. Oh, I'm sorry here, Carla. Should be received that prompt there again, Carla.
Hi, I know when I asked my previous question, someone said something about no back and forth, but I just want to be clear because this is my second time attending one of these meetings. Are the comments just to make a statement or to ask a question?
It's just your time to make a public comment.
Carla's gotten back on mute here, so at this time I don't see additional requests in queue.
Okay, thank you. Moving to agenda item number 9, the selection of 3 candidates to fill 2 licensed midwife positions and 1 licensed physician position on the MAC. Ms. Moriarty, can you please update the members on all the applications received for the vacant positions on the MAC?
Yes, thank you. In February 2026, the medical board posted a recruitment announcement for 2 licensed midwife positions and 1 licensed physician position on the Midwifery Advisory Council, MAC. These appointments are for 3-year terms ending June 30th, 2029. The current terms for the following MAC members will expire on June 30th, 2026. Madeline Weisner, licensed midwife, Mason Wilson-Tenev, licensed midwife, and Dr. Kenneth James, licensed physician. MAC members may recommend extending a member's term when no eligible or qualified candidates are available to fill a vacant seat. At this time, the board has not received any applications for the 3 positions that will be vacant on June 30th, 2026. Both Madeline Weisner and Mason Wilson-Tenev have expressed their willingness to continue serving until their seats on the MAC can be filled. Would the MAC like to recommend that the board extend the terms of Madeline Weisner and Mason Wilson-Tenev until new members are appointed?
Who would
I
speak here?
guess.
Anyone can make a motion for this, yes.
I'll make a motion.
Okay, thank you. And second,
Um,
thank you.
Thank
Thank
you,
you.
Ms. Wilson-Tenev. I appreciate not being the only one. Please, someone apply for these vacancies, please.
Thank
I
you.
live in New Zealand. I'm not practicing in California. Like, this is ridiculous.
The request
Thank
to
you.
extend the terms of Madeline Weisner and Mason Wilson-Tenev will be presented to the full board at the May 2026 quarterly board meeting for final approval. I wanted to mention that we did send an email blast out with the vacancies letter, and since yesterday afternoon, I have received 2 applications. So there is hope. They just weren't early enough to present at this meeting, but they will be presented at the September meeting.
Okay, so at the September, and then the subsequent medical board meeting will approve, and
Vote
then
to
those
approve.
terms will be vote to approve, and then those terms will be through June 2029.
Correct.
Okay, awesome. Thank you.
Thank you.
Very good. Any public comment on this?
If anyone would like to make a public comment for agenda item number 9, please do so by raising your hand or typing anything in that Q&A window. Give it a few seconds to see if anyone queues up. Not seeing any requests at this time.
All right. Moving on to agenda item number 10.
We had a
Oh.
motion in a second, so
Oh, God.
we'll
Okay.
do the roll call vote.
All right. Yes, please. Thank you.
Faith Freeman.
Yes.
Thank you. Karen Rosley.
Yes.
Thank you. Mason Wilson-Tenev.
Yes.
Thank you. And Madeline Weisner.
Aye, yes.
Thank you.
All right. The motion carries. Very good. Thank you. Thank you, everyone. Shall we move on to agenda item number 10? This is a presentation and discussion of the licensed midwife fund condition with Marina O'Connor.
Good afternoon. I'm going to go over the Midwifery Fund, and this is everything that was presented at the last board meeting in February, as of course we didn't have a quorum for the MAC meeting, so it was then presented at the next board meeting, which was in February. I'll first provide a background of the Midwifery Fund, a little bit on how we got here today, and then I'll go over the materials that are provided for this agenda item. So in fiscal year 2014-2015, the Midwifery Fund was appropriated $13,000 to pay for the cost of its cashiering, licensing, and enforcement functions. In fiscal year 18-19, the board requested an increase to the Midwifery Fund spending authority by $107,000 to ensure it could pay for the licensing, enforcement, and cashiering functions performed by board staff, bringing it to a total of $120,000. The Midwifery Fund's appropriation has not changed since fiscal year 18-19 and remains at $120,000, even though program costs have increased and exceed $120,000. While expenditures have remained around $120,000, actual revenues received have been under $100,000, creating a structural imbalance. Based on the recommendations of an independent 2020 fee study, the board sought a fee increase to the licensed midwife application and renewal fees, which the legislature approved through the board's sunset review process. Effective January 1, 2022, the license application fee increased from $300 to $450, and the renewal fee increased from $200 to $300. This fee increase was not enough to fully fund the program's operations, and the structural imbalance continued. The fund is currently projected to be insolvent by fiscal year 29-30. The board must seek a fee increase to ensure the Midwifery Fund can pay for the full costs of its operations. So now I'll go over the materials. There's two fund conditions. One is a status quo of basically just no change made to the fund. This is what's projected. And then the other fund condition shows projected or proposed fee increases. I'll go over the first fund condition first. It's a lot of information, and then I'll stop at the end for questions of this fund condition before moving on to the next, because it is a lot of information. So please feel free to ask questions. So hopefully you can see this. It's again in the materials. So if that's easier to look at than what's on your screen. So this is based on the governor's 26-27 budget. Again, this assumes if everything just continues as projected for the fund, no changes made whatsoever. So just to give an overview of what we're looking at here, at the very top, the first row is your beginning balance for the fund. So this was from the previous fiscal year, 24-25. The fund started with $231,000. That's that 231 at the top. Right below that, you'll see a prior year adjustment. So what that is those are actually expenditures from the fiscal year before that. So from fiscal year 23-24, but because because the costs of the Midwifery Fund are through shared services with the board, a lot of those costs aren't calculated till the end of the fiscal year. And so they don't meet sometimes don't make the cutoff for fiscal year end books closing. And so if they don't make that cutoff for being reported in that year, they get reported in the following year as a prior year adjustment. So that negative 48, that's 48,000 that was actually spent in fiscal year 23-24, but again, missed the cutoff. So it shows as a prior adjustment the following fiscal year. And then you have your beginning balance minus that prior year adjustment gives you your adjusted beginning balance for that fiscal year at 183,000. So that's where the fund basically starts off in fiscal year 24-25. Then right below that, it goes into the revenue, which is mainly from license and renewal fees. And then you have your total revenues, which shows 98,000 for that fiscal year. And then below that is total resources. So it's basically your beginning balance plus your revenue is your total resources. Keep going down, you have your expenditures. The first expenditure line, that's the board operations, the licensing, cashiering, enforcement functions. But as you'll see, it's a small number because and I'll get to it, but if you jump to the top of the current year, 25-26, you'll see another prior year adjustment. And that's again because we're projecting, again, it's not a final number, that negative 32 at the top, but we're projecting that's how much will be a prior year adjustment that were costs spent in 24-25, but again, missed that books closing cutoff, so we're being reported in 25-26. So the 88 plus 32 is 120. So then below the 88, you'll see 7,000 statewide pro rata. So that's what the fund pays for services from other state departments. We have oversight agencies. We have Department of Finance, Cal HR, a number of state agencies that support the functions of most, if not all, state departments. So that's what that 7,000 is. And then below that, of course, is your total expenditures, and it shows 95. And then your fund balance is 186 at the end of fiscal year 24-25. And right below that in green is your months in reserve. So that's basically what could the fund survive on if it didn't have any more revenue coming in? How many months could it operate for? So it looks healthy in this year, 17.4. But as you'll see, as the years go on, it's declining, and it's declining at a pretty rapid rate. So as I said before, by 29-30, we're expecting the fund to be insolvent. That's that red where it goes negative. The fund balance goes negative. So this is basically what would happen again if nothing changed based on what we know today, the financial information we have today. So before I move on to the next fund condition, which is the proposed fee increases, any questions on this screen?
Did I hear you? Am I correct in hearing you say the fund would be insolvent in 29-30?
Correct. Fiscal year 2029-2030.
Okay.
Okay. We'll move on to the next fund condition. So again, this is the governor's budget, same as the previous fund condition we're looking at, but here we've built in a proposed tiered fee increase, and that's the blue lines highlighted there. So I won't repeat everything from the previous screen. You have your 24-25 actuals that I went through, but you'll see in the revenue, those blue lines show when the revenue from the fee increase would hit. And so what is being proposed here is a fee increase effective Jan 1, 2028, and then another increase in Jan 1, 2030. So everything's the same in fiscal years 24-25, 25-26, 26-27. And so we'll skip to fiscal year 2027, 2028, when you'll see the first impact of that fee increase. And the reason that number is smaller than the following years is because that's a half year of the revenue. So a fiscal year is from July to June, but the fee increase is effective in the middle of the year. So that's just basically half a year of that additional revenue. And then in the following years, that's the full year of that additional revenue coming in. So again, starting with fiscal year 27-28, you'll see renewal fees projected at this fee increase, which would be $1,260 fee for the initial application and the renewal. That would bring in about $104,000 in that first year, and then $9,000, and then another $9,000 from the license app, and then you'd have your total revenue for that year at $206,000. And then if you keep going all the way down to the bottom, you'll see the fund balance is 158. The months in reserve is 4.8. So it's still in the green, still healthy. And then the next year, 28-29, that's when we get into you get finally a full year of that revenue coming in. You'll see the total revenue is $318,000 for 28-29. And then your total resources is 476. And here you're going to see a gray line. So right now, as I mentioned before, expenditures for the program are capped at $120,000. That's in the Budget Act. So we cannot spend more than $120,000 on the midwifery program. However, costs do exceed $120,000. The cost of doing business has gone up in the last, I think it's been 8 years since the last budget augmentation. And so what the actual cost of the program operations is closer to $370,000. So that $250,000 is the difference of what the additional expenditure authority would be to pay for the full cost of the program, which again is estimated about $370,000. So that's why that gray line is there to build in that additional authority to reflect the true costs of the program. And then at the very bottom, you'll see the fund balance is $81,000 and months in reserve is 2.5. And so you'll see it kind of starts to flatten out in those future years, 29, 30, 30, 31 at about 1.3, 1.4. It's still a relatively low fund balance, but it keeps it in the positive. right? Keeps it stable, because now with that revenue increase, the program's able to pay for the full cost of the program and maintain a positive fund balance. And you want to have those revenues balanced out with the expenditures, right? Your revenue needs to be slightly more, ideally slightly more than your expenditures each year. Otherwise you go into the negative eventually. So I just want to also just preface those numbers, that fee increase, the 1,260, and then the second fee increase of 1,570. Those are based on today's numbers. In order to do any of this, we would have to seek a legislative change, and that takes time. Carrie had mentioned, Ms. Webb had mentioned, we have sunset coming up. So none of this would happen until we got that legislative change made. By then, these numbers could change, right? Expenditures and revenue, can change each year. So I just have to say this is based on today, but by the time we're actually ready to do the legislative change and make a legislative proposal, it's possible those fee amounts need to be adjusted up or down, hard to say, or maybe they stay the same. I just have to mention everything's based on the financial condition as of today, which of course can change over time. And because the legislative process can take time, it could be, a couple of years before we actually get a statutory change. So I just wanted to explain that part. Any questions? I know that was a lot of information, so happy to answer any questions.
So I do have one quick question. Where might I find a breakdown of where all those monies are being spent?
So that's a good question. And I think Ms. Weisner mentioned before about, looking at a breakdown of the expenditures. So that's something we actually want to start bringing to the MAC on a regular basis. The MAC historically hasn't had any kind of, I guess you call it budget overview or budget update. Part of that, and I'm not saying that's the main reason, but my guess is part of that is because it's not structured as a typical line item budget because it's shared services with the board. So it's like a percentage of the board's expenses are billed to Midwifery for the midwifery part of those services. So you don't, for example, we don't track every single piece of paper or ream of paper bought for the midwifery program. We do a percentage of, paper. It's just, that's a very trivial small thing, but just to make, giving a simple example. But that doesn't mean we can't provide that information. So we're just working with the DCA budget office on coming up with a way that will show those expenditures in a clear way, so you guys can see what's being spent on staff salaries, staff benefits, licensing, processing license applications, enforcement workload. So that is something we're working on. I don't have today, but I'm hoping to have for the future MAC meetings.
Okay, that would be wonderful. I would also love to see some transparency around how those percentages were calculated and when.
Absolutely. Yeah.
I will say that when we met about this, there was a lot of information shared about the cost of investigation and enforcement. Because my initial response to these tables was like, oh my God, we couldn't, the Midwife Fund could not possibly be spending that much money. But it is, and the moral of the story is that the Midwife Fund has been getting a screaming hot deal on these expenses for a number of years. I think anybody hears information about midwife investigations or enforcement and thinks that that is a large portion of the cost and wants more information about that for sure. I want to know how many dollars are spent on undercover investigations in particular, or the complaints process, how many dollars are spent processing those darn forms that we all hate, right? But I think even if those numbers were perfectly reasonable, we'd still be insolvent, just based on the fact that there are so few licensees. The licensure fee is quite low compared with other professions currently. I'm intrigued to see how I know that inflation is not calculated in these estimates moving forward, and it seems like the value of the American dollar is not hot right now. And so I'm intrigued to see if licensure costs will in fact only quadruple, or if it will be much more than that. I don't know a lot of midwives who would be able to afford this licensure fee tomorrow, so I appreciate it being extended as far into the future as is mathematically possible. Are these changes going to be wrapped into sunset review, or are they going to be introduced elsewhere? I guess is my question.
I can't say for sure, but based on when we need these fees to take effect, I think it would align with our sunset review process. So that's probably going to be the best avenue, but I don't know if we've necessarily made that. We haven't started, we're still just starting the sunset review process. We'll be working on putting our report together this year. So that's not entirely up to me or finalized yet, but most likely I would say that's probably going to be a good avenue to have those changes made. And that's another reason it might seem, maybe it's not a bad thing, right? As you said, that the fee increase is so far out. It's just, again, based on the legislative cycle and the time it takes to get that proposal going through. It would actually, this is probably the earliest that would even be possible. But, and that's also why we'd tried to go with a more tiered approach. So it's not, even though it is a big jump going from 450 to 1,260, and that's because it hasn't been, the fee increase in 2022 wasn't enough. It was a small increase. So now we've got this big, significant increase, but hopefully that helps it a little bit. I know either way you say it, anything that high is not great. It's going to be hard on folks, but we were hoping at least with a tiered increase that would offset the impact a little bit. And again, it's for 2 years of licensure, so it's not annual. The renewal fee is to every 2 years, but as you mentioned before, it is actually somewhat in alignment with programs at DCA of a similar size, but we've just the appropriate fee increase is just happening at a very long interval. Again, I know we had a fee increase in 2022, but it was pretty small. It didn't really move the needle much, unfortunately.
Do you feel so these numbers take into account that there's not a ton of elasticity in the number of licensees?
Correct.
It doesn't seem like there's any even remote possibility that even if licensee numbers dramatically increased, that the fund would be solvent on current or a modest increase. Even if we had another 100 licensees a year, it wouldn't. Okay.
Probably not. It's if you look at the history of the population, it's pretty modest increases every year. It would have to be, like you said, pretty monumental increase to even make a small impact on these numbers.
And my understanding from the calculations is that midwives are licensed every 2 years, and so you took half of the licensees and used that to calculate the dollar amount per
Correct.
year. So that's assuming everyone is renewing their license too.
Correct.
So
no, actually, I think we only looked at. I couldn't say for certain. It's possible we only looked at active licensees, so we weren't looking at inactive or retired or anything like that. I don't remember off the top of my head, but again, it's a small difference. So.
Okay. Thank you. I really appreciate this. I know that when I met with the executive director, he threw the because my main question was the cost of enforcement, and he basically had said that like if the cost of one enforcement is $150,000, that just blows the fund away completely. So
Of one going all the way
obvious,
through the process. So like, complaint intake, investigation, going to the AG's office if we're going to file an accusation or take some type of disciplinary action. Going through that whole process can be very costly for even one complaint. And you're correct, just one it's happened before, it can completely, I won't say blow the budget because we can't go over 120,000, but it can easily make expenses go beyond 120,000 for a year. So.
yeah, and I know that like with the consumer protection piece on the physician side, there's so much discussion surrounding like the under investigation of physicians, or like the under enforcement basically of like these repeat offender physicians. And I don't based on the information that I receive, see that parallel with licensed midwives necessarily. But I'm wondering if the cost of enforcement has been dissuading the medical board from those enforcement processes for licensed midwives given the fund. And if licensure fees increase, revenues increase, that will embolden the medical board to perhaps increase investigations and enforcements. I think that's a real concern that licensees have about this, is like, why would we quadruple the amount of money we're giving them so they can lock us up, right?
Yeah, I mean, as I've said, we spend more than 120,000 on the program already. Yeah. So we have to, according to statute, according to the law, review and maybe investigate or take further any complaints we receive that we see as a, public protection issue. So the amount we spend on it doesn't necessarily have an impact because I don't know how else to say this. We're already spending it. We're already over 120,000. So that's clearly not a barrier to providing the services we have to provide and doing our regulatory function. So I personally do not see that happening because it's already not happening. Honestly, it's a small population, but you're right. If you just looked at the stats, not a lot of enforcement cases, against licensed midwives. They're pretty rare. And that has nothing to do with the budget or the fund, condition. We process those complaints as we do with, any other complaint that comes in for any other license type. Obviously different exceptions, which we talked about, licensed midwives serving as medical consultants rather than physicians. But, so yeah, I mean, I could understand that fear, but it's not what we're doing now. And I don't think that would have any impact on it. In fact, regardless of, how this goes, we're looking at what we can do to save on the enforcement side, because when investigator rates increase and AG rates increase, that impacts all the license types. We're always looking at, that's not just midwifery fund, that's board's contingent fund as well. So we're always looking at ways we can make the enforcement process more efficient, make sure we're prioritizing cases appropriately, and looking for ways we can better work with HQIU, which is our investigative unit under the Department of Consumer Affairs, and the AG's office, to make sure we're spending the appropriate resources on the high priority cases. Again, not that we don't investigate low priority, but maybe there's other avenues we can take, right, with certain cases. Maybe it doesn't have to go to, all the way through the process. If there's other things we can do, whether it's a cite and fine or something, to work with the AG's office on the appropriate resolution. But also looking just at our processes, how can we make them faster, more efficient, and still protect the public, right, without changing that standard. So that's something we continue to look at, not just for midwifery, but for all the board's enforcement functions. And we have made some progress. Again, there's not a whole lot of enforcement cases against midwives, so you may not see like an immediate, impact on that. But unlicensed cases have come up. That's an area we're always looking at how we can, more efficiently use resources towards unlicensed activity cases. I know you all were talking about the transfer form, the out of hospital transfer form. That's a big area, that we can look at. So anything like that, we're trying to look at that we can help manage costs, but not sacrificing, right, the public protection. So
the bill that is like regarding the legislative updates, there was I want to say it's a physician wellness program, but it sounded like it would apply to all licensees because it was listed in the relevant legislation for midwives. I'm wondering if that would impact the cost of enforcement for midwives to be included in such a program. Like, I do see occasionally there are enforcement actions for like if a licensee gets a DUI, right? Where obviously the medical board has to do something about people practicing midwifery if they have a DUI. Do you feel like that would increase costs to the program or decrease them?
So it's hard to say at this point because right now that bill is only focused on the policy side. We haven't gotten into the source of funding for the program.
Okay.
Ideally, it would be, other entities contributing to the funding of that program, but the cost ultimately part of that cost would be borne by the participant. If someone's participating in the program, they'd have to pay the cost, but ideally we'd find funding sources to offset that cost to the participant. So it's not a deterrent for them participating in the program. Could part of that come from licensing or renewal fees? I don't know. I wouldn't be able to say at this point because we're not there yet on, this bill is just for the policy side, getting the program in place. And then we're going to work on the funding side on how we can fund the program with as little impact to the licensees as possible. Because again, we don't want it to be a deterrent, right? We want people to participate.
Right, totally. Thank you. My last question is, how did it get so bad? like, it seems like it's definitely different leadership has come into play, different administration and organization, but was there some sort of deal cut with midwives where it was like, we know how expensive overseeing this program is, but we just are gonna pay for it? Or was this an omission where no one was really paying attention?
Yeah, no, it's a fair question.
No, it wasn't.
I
know it wasn't you. I know
That's
it wasn't
okay.
you personally.
Well, I was going to say,
I'm just,
I can't speak to anything that happened before I was with the board, which was about end of 2019, early 2020. But so I don't know about what went on before that. But I can say when I was at the board, this was completely on our radar. And at that time, I came in on the tail end of the fee study. And so the fee study actually was taking place in 2019, I think through 2020. And then what came out of that fee study was that fee increase I mentioned in my presentation, that small fee increase, which didn't take effect till 2022. So we had to see the impact of that fee increase before we could ask for another fee increase. And at that time, might be different now, but at that time, the legislature was not really entertaining fee increases without a fee study. You had to have a fee study if you wanted to do a fee increase. So we had to follow the recommendations from that fee study, which led to that 2022 fee increase, see how that impacted the fund. And then clearly it was not sufficient. So we've been working with DCA for quite a while on how to resolve this.
okay. Has the Midwifery Fund ever been doing well in history?
So it's hard to say because, as I mentioned earlier, really the first appropriation was in 2014, 2015, which doesn't seem that long ago. That 13,000, I couldn't even tell you how they came up with that. It was so long ago before my time. So how long does it go back where the appropriation didn't represent the actual cost of the program? I honestly could not tell you that. So I can only tell you what I know, which is what's in the fund condition. And I know you guys can't see every fiscal year of history there, but it seemed to be doing okay. And it actually had some fluctuations here and there, but because I don't know exactly the decision making and what went into those estimates and costs beforehand, I couldn't really tell you what was going on. But when I came on board, it was clearly an issue. Like there was no question about it that we were not headed in the right direction. So we've been monitoring it closely.
Thank you. I
Also,
really
just the cost of
appreciate your
everything
time.
has been going up a lot.
Yeah.
As we all know
Yeah, it
lately,
doesn't
not
seem
just
like
recently in the
anyone.
last couple of years, but for quite a while. So
Yeah, it's clearly an untenable situation. Are you able to tell me how the licensure fees of physicians and of any providers that are paying similar rates to the proposed fee increases?
sure. Yeah, I have a couple examples. Let's see. The Professional Fiduciaries Bureau. So it's a bureau, not a board, which just means that it's under the direction of the department's director. So it's under the department. It doesn't have an independent board. I mean, I think it might have an advisory council, but I'm not 100% certain. So they have about 875 licensees, which is more than Midwifery, but still under 1,000, somewhat close. They have an annual, no, I'm sorry, they have a biannual renewal fee that is $2,600. So that's about $1,300 annually. There's the Podiatric Medical Board, which is, very obviously close, intertwined with the medical board. Again, bigger licensee population at 2,000. But even with that licensee population, their biannual renewal fee is $1,900. And I want to say theirs went up recently, like maybe in the last 2, maybe even 3 years. So I know they've had to do fee increases as well recently. But those are the 2 examples I have that I think are size-wise closest to Midwifery.
Are there any licensees where their licensure fee is like in the 300 range? Are there any licensees?
Not that I know of.
Or are we like the last holdouts?
I couldn't say definitively, but from what it looks like, that it does look like the Midwifery has been due for a large fee increase for a while. I mean, the nature of fee increases, again, because it's mostly statutorily mandated, some programs have in statute a fee range, which allows them to increase or decrease fees within that range through regulation. Midwifery structure and med board structure is our fees are in statute, like a specific fee, not a fee range, which means every time we want to change the fee amount, we have to go through a legislative change, which of course takes time. You're always working with old data. And then, like I said before, at one point, and maybe still today, the legislature wanted to see a fee study. So now you got to add in the time it takes to do a fee study, then the basis of the recommendation from the study, bringing that through a legislative change. Let's just say the process is not reflective to, or not conducive to like quick reaction. So like, oh, we really need to do something. We need to increase fees. And then just next year you increase fees. And then of course, as you're going through that process, it can be getting worse, right? The situation's getting worse. So you try to do it as preemptively as possible, as years in advance, anticipate what's coming. But what makes it very tricky for small programs with small budgets and small funds is you're more susceptible to small changes have a big impact on you. Whereas like a big fund, like the medical board contingent fund, we have more flexibility, more room. Like one little thing won't throw the budget or the fund. I say little thing, like there can be a legislative change that can have a big impact, but smaller programs, smaller budgets, it's harder to be flexible because you're working within such a small, sensitive budget and expenditure authority. So unfortunately, it doesn't work well when you see that program, maybe it's doing okay for the last 5 years, and then a big whatever case or something, litigation, something big hits, and now it's all of a sudden plunging into the negative, and you've got to, do something about it in a short amount of time in a process that can take years. I'm not trying to like be cynical about it, but it's just the reality of the way it's done at the state. state level and the susceptibility to smaller funds and smaller budgets, it's much harder to manage. You have to keep a very close eye on it and try to work as quickly as you can to address, you know, any change in the fiscal outlook.
Ms. Weiser, I think it's important to point out that while licensing fees might be higher for physicians and for other healthcare providers, they also have dedicated boards. And so that means they have a different kind of representation, and that's part of what they pay for with their licensing fee. So if our licensing fee is quadrupling, but I still don't have an expert reviewer in midwifery who might be looking at a disciplinary hearing, I'm not really getting the same benefit that another licensee might, even if they're paying closer to $2,000 for their license. So I think it's really important to think about what are constituents getting for their money, not just how much does it cost. And I hear this is a Queen Mary, it's difficult to steer this particular ship. But I think if we're going to be comparing licensing fees, we need to be comparing apples to apples. And unfortunately, midwives are the oranges in the apple cart. So it's really hard to make that direct comparison. And I think it's going to be a hard sell to the licensed midwife constituency. And many people are going to wind up giving up their licenses so that they can maintain their practices. And we're going to see a rise in non-licensed midwifery, which is going to be a bit of an unintended consequence here.
I think you're right. Yeah. Thank you. Are there any other comments from members of the MAC? Anyone have anything they'd like to ask or share? Well, thank you. Thank you for all of your time going through these, and for being forthcoming about it. I really appreciate that. I look forward to seeing how this goes. Shall we invite public comment?
So if anyone would like to make a public comment here on agenda item 10, please do so by raising your hand or typing anything in that Q&A window, and we'll get you called upon. I'm not seeing any hands or requests to comment to this time.
Okay.
Thank you. Appreciate everybody's time. Thank you.
Yeah, thank you so much. Moving to agenda item number 11, future agenda items. Do any members have agenda items for the next MAC meeting? Are there any public comments?
Yes, if anyone would like to make a future agenda item selection or request, please do so by raising your hand now or typing anything in that Q&A window. Give me a few seconds to see if anyone queues up. Oh, sorry here. Marina had put her hand up. Marina, I'll put you back as the panelist. You should be able to.
Sorry. I just wanted to mention, at the last board meeting, we had a couple presentations, one by the HQIU chief, which is again the investigative unit under DCA and the Attorney General's office. And then the meeting before that, we had our chief of enforcement present as well. And basically these presentations go over, they went over their roles in the enforcement process, what we do. So our chief of enforcement presented on, from the filing of a complaint and how that complaint proceeds through the process. And same with HQIU when they get a case referred to them for investigation, what their process is. And so I think those were very helpful presentations, and we recommend anyone to go back and watch the recording if they can, but also wanted to put out there, if you are interested in similar presentations, please let us know.
I feel like that's a great idea, just because questions continue to come up every single meeting about the enforcement process and the complaint forms, etc., that perhaps we should make it a regular thing. I always feel bad because we grill them so heavily, but that's what we're here to do. So yes, I would like to suggest that as well, that someone from HQIU present on the investigation and enforcement process for licensed midwives.
And I just have to throw out there, it's again, just like subject to their availability, but we'll work with them on when they're available. So if it's not the next meeting, maybe the meeting after, but whatever we can do. But we don't have a chief of enforcement right now. We're actually recruiting for one, but once we have the chief of enforcement in place, obviously they can present anytime at any meeting. On a regular basis, again, we would just be presenting what the presentations we did in the previous meetings were just an overview of the process, more for educational purposes, knowledge, and also a chance to ask questions. I would just say if you wanted a more regular update, just to maybe more define what you would want, if that's from our chief of enforcement, which again is fine. I'm sure we could have someone from enforcement if you wanted a regular update, but just I would separate it from the type of presentation they gave, which was just an overview of the whole process. We don't do that every time. Maybe we do it, regularly once a year or once every other year, or as we get new members, it's, that happens. But if you want a regular update, maybe just define what you would want in that update.
Cool, thank you. Any other agenda items for the next MAC meeting?
And just to clarify, I don't see any additional requests on the public side.
Ms.
All
Weisner,
right.
I can go over the standing agenda items and a few of the agenda items that will be added for the September meeting if you'd like.
Yes, please. Thank you.
Okay, you're welcome. So for the standing agenda items, we have approval of minutes, report from the MAC chair, update on midwifery related legislation, and the program update with the LMAR report. The other agenda items that will be added for the September meeting are voting on the 2027 MAC meeting dates. Did you also want the report from the task force on Medi-Cal related issues added?
No.
Or no? Okay,
Yeah.
I will remove that. Also, voting on MAC vacancy applications. We'll have that on the agenda. And did you want to discuss with the MAC a regular update, or did you just want us to check and see if we have someone available to make a presentation on investigation and enforcement? We can do that, and we can just let you know when that's available, when someone's available to do that.
Yes, I would like for you to let me know when someone's available for that. Yes, please.
Okay, we will do that.
That sounds good.
Did you want to discuss a presentation to the board at the next meeting?
I'm going to just throw one together and send it. I'm going to throw one together and send it and ask directly when I can do it.
Okay.
And I'm going to do that over and over again.
Okay. Well, how about, did you want anything on hospital reporting forms?
I feel like that could be included in the item with
Investigation
someone from
and enforcement?
you. Yeah. Yes,
Okay.
please.
Perfect. Okay, that's all we have.
Awesome. Any other comments from the members? Closing words? All right, this meeting is adjourned. Thank you, everyone. Good to see you.
Thank
Thank
you.
you. Bye.